Wonderful to be here with you today. Thanks to LinkedIn Local for making this opportunity for us all, and also special thanks to Instillery. I'm Shelly Campbell, the CEO for Cancer Society for our region, and Instillery are huge partners of ours over the last few years. They've modernised our business along with us and really assisted us this year to have continuity of our business at a really critical time, and we're grateful for that, I have to say. I've spent my day in Wellington next to a gentleman who spent the entire day trying to influence my vote and talking about the election. If anybody here is thinking of continuing that conversation with me, you should know I've already voted. I don't care how you're going to vote, and I don't believe in 5G conspiracy theories. So our services for Cancer Society, we cover from South Auckland, the whole of Waikato, down to Taupo, Taumaranui, across the Bay of Plenty, right down to Whakatane and including Gisborne. That's about 740,000 people, so we have a really big region. Our organisation deals with research for cancer. We're interested in the prevention or modifiable risk factors for cancer in our schools and our communities, how we teach people that. And of course, when people get a diagnosis of cancer, we have the Cancer Lodge here up on the hill and our outreach nursing services to help people through that journey with their whānau. 7 months ago, I was on, in addition to my job, a ministerial appointment to review New Zealand's health system, and I was getting excited about a 6-week holiday to Europe. Is anybody with me? Did anybody else have a trip planned? Yes, we did. Thank you, Air New Zealand, for holding my funds. Anyway, I finished the ministerial review at 4:30 a.m. on the Tuesday morning, and by Friday, I was in lockdown, working frontline at our Cancer Lodge 7 days a week. So not quite sangria in Madrid and champagne in France that I had been anticipating for the previous 18 months. I have to say though, New Zealand disassembled our public health infrastructure really about 12 years ago in New Zealand. So it's incredibly remarkable that we have been able in a pandemic to stand up so quickly, such a strong response. And we made some mistakes. We didn't get our supply chains right, we didn't get some of the border security right, but you know what? We didn't make mistakes that sacrificed thousands of people's lives as occurred overseas. And so I'm really proud of our health system and all of the people of New Zealand for so far what we've been able to achieve. So our services for Cancer Society, we cover from South Auckland, the whole of Waikato, down to Taupo, Taumaranui, across the Bay of Plenty, right down to Whakatane and including Gisborne. That's about 740,000 people, so we have a really big region. Our organisation deals with the research for cancer. We're interested in the prevention or modifiable risk factors for cancer in our schools and our communities, how we teach people that. And of course, when people get a diagnosis of cancer, we have the Cancer Lodge here up on the hill and our outreach nursing services to help people through that journey with their whānau. 7 months ago, I was on, in addition to my job, a ministerial appointment to review New Zealand's health system, and I was getting excited about a 6-week holiday to Europe. Is anybody with me? Did anybody else have a trip planned? Yes, we did. Thank you, Air New Zealand, for holding my funds. Anyway, I finished the ministerial review at 4:30 a.m. on the Tuesday morning, and by Friday, I was in lockdown, working frontline at our Cancer Lodge 7 days a week. Our organisation and Cancer Society was incredibly fortunate. We have a really strong board, very strong public health intelligence and clinical leadership. And when we saw the writing on the wall for COVID, we just chose 3 priorities. I'm from a defence background. Is there anybody here from Navy? No one from Navy, really Waikato. I love having a small number of priorities. So the priorities we chose were anybody going through cancer treatment, we wanted to keep them safe and continuing their treatment. We wanted to ensure that our team were well informed and connected to us. And we wanted to ensure a sustainable business. We've been here for 90 years. We want to be here for another 90 years supporting our communities. So we allocated our management team to key operational roles. By level 3, we were ready for full lockdown, and we redeployed our entire staff across the region to get people to treatment. And we created an enormous bubble, 72 rooms up at our Lions Cancer Lodge on the hill, with 2 teams rotating 24/7, ready to staff that facility. And we did that in 48 hours. It was a massive effort. Who knows the difference or the health terminology for clean or dirty when you're talking about COVID? Anyone? It's health speak. Clean or dirty refers to clean facility. Health facility is assisting those people who are not COVID positive. Dirty means that you are looking after people that are COVID positive. And generally you have to make a choice about which one you want to be. We decided for our region we had to have the ability to do both, because people with cancer need to continue their treatment even if they've got COVID, because potentially they might die from the cancer that they have. So we made a call to go both. So we got infection control approval for full isolation facilities so that anybody in our region who had cancer in treatment, who tested positive for COVID, could continue to be safe and continue their treatment. And I'm really grateful and thankful that we've never had to use that to date, but I also feel confident to know that it's there and we can do that if we need to tomorrow. Because people with cancer need to continue their treatment, even if they've got COVID, because potentially they might die from the cancer that they have. So we made a call to go both. So we got infection control approval for full isolation facilities so that anybody in our region who had cancer in treatment, who tested positive for COVID, could continue to be safe and continue their treatment. And I'm really grateful and thankful that we've never had to use that to date, but I also feel confident to know that it's there and we can do that if we need to tomorrow. Pivoting for me and for my staff means that we will do whatever is required. It's as simple as that. Roll up your sleeves and do whatever you need to do. I had health promoters driving the shuttle to get people up to the hospital to treatment. I had receptionists doing house cleaning, cleaning the cancer lodge. I had fundraisers delivering meals to our patients at home because they were immune compromised and couldn't go to the supermarket. Pivoting means you will do whatever is required to get the job done. I also want to make a comment about health providers in our region, because what I saw was a huge amount of collaboration going across borders, supporting each other in a way that I think prior to COVID would have taken us months, perhaps years, to actually negotiate. And people just got on and did it, because actually that's what was required of us. I think more recently we've had to remain really vigilant about the risk of community transmission, and we need to, right, because COVID's still with us and we're learning to live with it. I think what I'm starting to see in my staff, I'm seeing more mental health issues, I'm seeing anxiety, I'm seeing fatigue and tiredness. I see people nodding, maybe you're seeing that in your own organisations as well. And it's uncertain times that we live in. So last week we started a campaign at work called Nobody's Smarter Than All of Us. And the idea is that you don't have to rely just on your own resilience and your own strength to get you through the next few months. Rely on your colleagues, rely on our combined strengths that we have to kind of get us through. And so, I'd really encourage you in your own workplaces to think about what that looks like for you and how you make that happen. Now, many of you will have negative stories about the health system. I do, my family does. But I wanted to finish on a kind of a positive story really about something that happened to us through COVID that proves what happens when our health system gets it right. So it was level 4 lockdown. It was a Friday night. It was 7 o'clock at night. And I got a call from one of my nurses. She said, we've got this 22-year-old patient. He's a young guy. He's got a very aggressive neck cancer. And he needs proton beam therapy, which is a very specialist form of radiation. It's not available in New Zealand or Australia, actually. There are only a few clinics around the world. And she had just got a phone call to say that the clinic he had been approved to go to in the States had declined because they were no longer taking non-Americans into that clinic. And what we knew is that if he didn't start that treatment within a month, he would die. And so at 7 o'clock on a Friday night, and she said something profound like, it's a shit time to get cancer. Which is true, there's never a good time to get cancer, right? And then the second thing she said is, look, this could be our boy. This could be our son. And we have to do whatever it takes. We have to find a solution. So we're in the middle of COVID. There aren't that many planes flying. Clinics around the world aren't taking Kiwis. You know, they're focusing like we are on our own people. And so I said, all right, leave it with me. So 7 o'clock on a Friday night, and I rang the Director General of COVID, who's a friend of mine, Kiriana Brooking, and then I rang the Clinical Advisor for Cancer Society, and I rang the CEO for the National Cancer Agency and said, you've got to help us out. This is our problem. And on a Friday night, they were all at work. We rallied MFAT to find us safe flights out. We rallied the ministry team to get us approval to fund this young guy to go to another clinic around the world. We got excited on Sunday night. We found another clinic in the States that he could go to that would accept him, but they wouldn't allow our insurance to work, which meant if him or his mum got COVID, they wouldn't pay for it. So we were really disheartened. We thought, damn, we thought we nearly had it. And we couldn't take that risk with them because it was likely that they would get COVID. And so we kept working for the next week with his medical oncologist until finally we found the last place in the entire world that does proton beam therapy in Wales who said, we will consider a Kiwi. And at 3 o'clock in the morning, the Welsh team and our medical oncologist reviewed his notes and files, and they agreed to take him. And we got him on the next plane as fast as we could. It was the only plane and the only route in the entire world that we could find to get him there. And this week he finished his treatment. And what COVID has shown us is, you know, that a health system staffed by people who care about what they do, who care about the people that we look after, who are prepared to do whatever it takes, is actually what Kiwis deserve, pandemic or not. Thank you.